I'm very pleased to introduce Mary Cain, who's Managing Director and Futurist at an organization called Transforming Health Through Technology, or HT3. And I have a very long association with Mary. She spent many years at the Institute for the Future, where Ian Morrison, who you'll be hearing from this evening, also did time as a futurist. So I think you have two folks in your midst today who can really help you think about what's coming, as well as talking about what we're seeing in the healthcare system now. So one of the reasons we brought Mary in today, that there was a big interest in consumer behavior and consumer engagement, which is obviously something that faces all of us who are trying to change and improve healthcare systems, recognizing, as Mark pointed out today, and I think Tom pointed out later, that for diseases like diabetes, the vast majority of the healthcare that goes on with the consumer or the patient or the person actually being able to manage their own care. It's been a real challenge in healthcare in the US, and I'm sure in all of your countries, and there's been a lot of interesting research and science emerging, a lot of interesting work emerging on consumer engagement. So I'm going to turn it over to Mary, let her walk us through a presentation, and then we will engage all the consumers here in an interesting exercise that I hope will shed some more light on this.
Thanks.
So thanks.
Thanks, you guys. So actually, you've been doing a lot of consuming of information, so this part of the agenda is actually going to be you doing most of the work. I'm just going to set it up and tee it up, and then we're going to split into groups, and we're going to do an exercise in each of the groups that's going to require you to use your brains and think about your the specific scenario and how to apply what you've learned or what you're thinking about to the specific scenario. The work that I did after leaving Institute for the Future was building clinical programs for disease management for a national disease management company. And those involved programs for diabetes and heart failure, a lot of the chronic diseases that require an individual to change their behavior in order to prevent exacerbation of their disease in the future. While I was at the Institute and also in disease management, I focused a lot on consumer behavior and how do you get people to do something different than what they're currently doing. It's not just about access to information. Frankly, it's not just about access to healthcare. It has a lot to do with how people think about their health and how they engage in their health on a daily basis. So we're going to talk about different roles that people play throughout their lives and different roles that they play relative to their health and how you might engage people based on the role that they're playing. So let me find my mouse over here. There we go. Come back. Okay. So the agenda is to talk about 3 different types of technologies, and I really appreciated Mark's definition of technology as being an expansive definition of technology, not being one that was just associated with bits and bytes, but really thinking about processes, thinking about different ways of organizing how work is done. So we've got 3 areas: social media and social networks. The 2 are connected, but I'm going to talk about them in slightly different ways and give different examples. Filtering tools, helping people see through all of the stuff that's coming. And I don't know if any of you guys had a chance to do the pre-reading. I sent an infographic about the avalanche of sharing and just this idea that we are increasingly inundated with massive amounts of information. So how do you filter among that? In the United States, in particular, there's a need to increase convenience. Mark talked a lot about this as well with his idea of taking the task out of the hands of somebody who's specially trained and putting it into the hands of the consumer. And a lot of administrative tools can help individuals experience a greater sense of empowerment and an ability to do what they want to do. And then we're going to talk about this spectrum from patient to consumer to citizen. Then we'll do the exercise, which marries the 2 of these. So social media. It's a broad category. We're going beyond the technology itself and talking about influences of social networks. And this is really about how people connect with one another. Facebook has 800 million users online. Obviously, a lot of them are in the United States, but Indonesia, surprisingly, is a huge consumer of Facebook. There are lots of people in Brazil and India, all over the world are using Facebook. It really started out as a way to share photos, and it became this thing where people can share lots of different things using Facebook. Increasingly, there are more and more apps for Facebook. Twitter, Mark again gave a great example of Twitter. and how Twitter had an impact on the Arab Spring. Quora, I don't know if many of you guys are familiar with Quora and Reddit. This is another way that people are using basically a question and answer format to make suggestions for one another about the best way to do X. So you can ask any question: where's the best Chinese food in San Francisco? Where can I get the best, who's the best surgeon in the country for X type of condition? And individuals crowdsource the response. So people respond with their answers, and then other individuals, as they read those responses, vote up or down. So it's really this bringing the large numbers of people and their varying levels of expertise together to filter up and filter down different responses to questions people might have. It's very democratic. You can enter any question. You can, vote up or down on any question. What ends up happening is lots of things get filtered through this massive number of people looking at it, and it seems that interesting and correct, often, things rise to the top, just through the sheer numbers of people voting. I think the last one that I'll mention is really taken Facebook and applied it to a business context, and that's LinkedIn. And in the United States, again, LinkedIn is used for job hiring. It's used for recruiting. It's taking this networking that you used to do at cocktail parties and is taking it online. So let's go a little bit into the social media piece. In the United States, 89 million people tapped into social media for health-related purposes. And I think what's interesting here is that it's not really Facebook that people are using for health. Facebook is about bragging or it's about whining. It's not really about sharing something that's embarrassing to me or potentially stigmatizing to me. I think this is going to change over time as different smaller groups of people make their places on Facebook. But instead, what you find is there are organizations like Cure Together. Cure Together is basically it's a grassroots organization that's devoted to helping individuals find non-traditional solutions for their clinical problems. So there's all sorts of things that you'll find on Cure Together, and individuals answer questions about what they've tried and how successful it's been. And what they've found is that lots of solutions that are put forward by the traditional medical care system don't work for a lot of people. And so people are, again, crowdsourcing different solutions and finding different ways of doing this, going outside of traditional channels, going outside of the traditional healthcare system. Another example is Genomera, which is a participatory research group that is going outside of the clinical trial system. And Genomera is setting up its own system as a way of shortcutting what currently takes a very, very long time in the clinical research, the clinical trial process. So that's really on the social side and getting us connected to one another. But also organizations are using Facebook, are using social media to reach out to their communities. They're reaching out to expand their marketing budgets. It's extremely cheap to do an online social media solution. They are trying to create a presence. They're managing their reputation. They are doing fundraising. This page for this hospital, this is Children's Hospital in Boston, has 690,000 likes on it. So 690,000 different people have gone to the website for this hospital. There's a guy by the name of Ed Bennett who has, in the United States, looked at the social media tactics and social media approaches for all the different clinics and hospital systems, and basically created this very cool interactive map that tells you where can you find what information about how these organizations are creating a presence for themselves online. And then the other example is another creative example. This is the Children's Hospital page where they had a contest to help the hospital name the robots for their page, right? So it's taking a step back from traditional marketing, taking a step back, kind of making fun of themselves a little bit, having a little bit more fun, trying to relax the way that they interact with their community. So this is really talked about social media, and I want to move now to talk a little bit about the power and the influence of social networks. This is another thing that I sent as a pre-reading, which was the obesity study that Christakis and Fowler did, and basically what they have learned, which is somewhat obvious, but they've proven through their work, is the infectiousness of our behaviors. And in particular, they've looked at obesity, they've looked at smoking, they've looked at other things, and not just the fact that I'm influencing the person who's directly related to me, either through my family or a close friend, but that this impact on behavior goes out 3 connections. So my friend's friend's friend is influenced by my behavior, right? And I think a really interesting way to think about this in terms of social networks is this study that they have done where they've shown the linkages between the people who are yellow, who are obese, and the people who are the green circles. And let's see, just a 2-minute.
This animation is a dynamic graphic representation of a portion of the Framingham Heart Study social network. Each circle or node represents one person in the data set. Nodes with red borders are women, and nodes with blue borders are men. The size of each node is proportional to each person's body mass index, or BMI, which is the weight in kilograms divided by the square of the height in meters. A yellow node represents an obese person with a BMI greater than 30, and a green node represents a non-obese person. A line between 2 nodes represents a social connection between 2 people. Purple lines connecting nodes denote close genetic ties, for example, parents, children, and siblings. Gray lines denote non-genetic relations, such as friends and spouses. Obesity is a multicentric epidemic, with many people influencing one another and forming ties in complex ways. The network gets more compact and dense as more ties appear, and the entire network gets heavier over time. Quantitative analyses demonstrate a tendency for obese people and non-obese people to form clusters within the network, so that by the end of the study, this clustering can be discerned, as in the densely interconnected clusters of obese persons here, and the non-obese persons here. The prevalence of obesity appears lower at the periphery of the network as compared with the center.
So the point of this really is just an illustration of what Fowler and Christakis have found through their work. And I guess what I am interested in is, okay, so we're all connected, we all know one another and are influencing one another. So what can we do about it? Does anybody recognize the guy on the left? Rick Warren. He's has a church with 20,000 people in weekly attendance in Southern California. It's a very conservative church. It's the 8th largest church in the United States. And he had this marathon baptism day where he baptized hundreds of people. And he realized halfway through that he was exhausted and that he was having a really hard time, because he literally dunks people in the tub. And he was having a really hard time getting through the day. And part of the reason for that was because he himself was obese and out of shape. And cardiovascularly, he was struggling with having enough breath to do what he wanted to do. So he started to preach about, we all need to get healthier, and I need to get healthier too. The church created this thing called the Daniel Plan. The Daniel Plan has exercise, it has nutrition, it has all of these very famous physicians in the United States. Dr. Oz is an example, somebody who's a television personality. Dr. Amen is involved. And the interesting thing about this is that church has lost 250,000 pounds in a year. Rick Warren himself has lost 60 pounds. He talks often about how hard it is, how much he's struggling. But I think the other thing that's really interesting is he has basically set norms, new values for that community. And those values include talking about diet, talking about exercise, doing things together, having community meetings around those things. It's very similar, actually, to Alcoholics Anonymous in the sense that when somebody new comes into the community, that person is brought in, is mentored, is indoctrinated into the values of that community, and those values then are used to help that community be healthier overall. I'm not suggesting Rick Warren is my religious choice. What I'm suggesting is that it's possible to influence a network. It's possible to influence a large number of people. through changing how people think in generally in the community. The second set of technologies are filtering technologies, right? There's as the avalanche of sharing infographics showed, we're just having there's increasing amounts of information out there, increasing amounts of knowledge out there, and it's hard for people to know what's the right thing for me. How do I know, how do I pick among all the things that are out there? What's good information, what's not good information? And if we think about this in the context of health decision making, there's a need for making sense. Mark talked about moving more toward science. I think that some of this is that interpretation of the science to the individual and making meaning for me in terms of what I need to do on a daily basis. How do I filter that by where I am in my life? How do I filter that by what I have access to? How do I filter that back by my risks? And what we've seen an increase of in the US in particular, and I think also in other parts of the world, is a focus on design of information to create clarity, to create transparency, to help people understand what their options are. And in the context of Safeway, for example, this is value-based benefits design. Constructing a system that allows individuals to understand what are my incentives for picking this provider over that provider, and how do I understand the value of that for myself. So Cake Health is the example on the left here. They're using very clean infographics of green and yellow and red to let people know when they're in trouble. The example on the right is Castlight, and that example is actually something that people would have access to on their cell phone, because people are using their cell phone more and more as the tool that they're using for information access. So again, this is really a focus on user experience, on information design, on presenting something in a very clean way, in a very pretty way. And what you'll find, particularly very specifically in the Bay Area and Silicon Valley, is that leadership in different organizations are more and more user experience engineers, people who have an understanding of how to present information. And that change from the difficulty, the very academic, non-easy to understand information to more easy to understand information is happening. The final set of tools are administrative tools. How do I get access to my physician in as easy a way as possible? As Mark mentioned, it's about faxing, it's about telephone calls. And the other example here is this idea of using text messaging, using billboards for that matter, to draw patients into your services, to draw patients into your ER. So let's now think about this spectrum of patient to consumer to citizen. We often think about the patient as the person who's very passive, laying in bed, not able to do much, or we think about them as the folks in the bottom left, older generation individuals who maybe aren't going online, getting as much information. But the guy in the yellow hat there on the right-hand side, that's my dad. He's a cancer researcher. He's 82. He's had multiple stents put into his heart. He had a neobladder. After his bladder was removed, his bladder was replaced with a new bladder made out of his stomach. And when he went to talk to the doctor, he was expecting a consultative relationship. He wasn't expecting the doctor to tell him everything. In fact, he had done research on a process in Italy that involved using heat as a way to get rid of cancer that his cancer surgeon at Johns Hopkins was not aware was in practice and being used. So I think that we need to think that individuals don't necessarily fit into generational categories, and that individuals can play the role of consumer even if they look like a patient. And then the last group of people are really folks who are activists. People are advocating for access to drugs, people who are advocating for access to play a role in research, and the Cure Together and Genomera are examples of participatory research groups that are moving, that are in the activist role and are really hoping for a dialogue. So these three different groups, the patient, the consumer, and the citizen, are the target audiences that you're going to work on in your exercise. Each of the case studies has a different focus group that they're focusing on, and they all have different needs. And if you want to change their behavior, you have to take into consideration what's motivating them and what their needs are. So patients are seeking information, but they're really seeking meaning. They're seeking emotional support. They want to understand why this is important to them. Consumers are trying to understand the options and want consultation. They might need help with filtering. And then citizens want a dialogue. They want to co-create the value. They want to disrupt the status quo. So this last mapping maps together the 3 different types of tools, the different types of end users who might be using those tools, and then how the final line across the bottom, you might want to use social media and community leaders to influence your community, if that's the target of the objective of your case study. For those who are consumers who are trying to make choices among different options, you might want to use filtering tools to nudge that population to the best solution. And then finally, on the administrative tools, create that experience of convenience, help individuals reduce the hassle in order to help individuals get to the services that they want. So that was it for the presentation.